Welcome to CareHero podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Hello, Care Heroes. Thanks for tuning in to another episode of CareHero Podcast. I'm your host, Martin Hoy.
And I'm Gerard Hernandez. I wasn't able to join Martin for today's interview, so we had our HR extraordinaire, Paula Hildley, fill in for me. But don't worry, though, we've got a great guest coming up with today's CareHero Podcast episode.
Yep, today we have Karen Clements, the Chief Nursing Officer at Dartmouth-Hitchcock Medical Center, joining us from the beautiful city of Lebanon, New Hampshire.
That's right, she's a senior healthcare nursing executive and clinical leader with more than 30 years of nursing experience.
And Karen has a marvelous story and great tips to share with the Care Hero community, such as the importance of finding a career that speaks to you, to always remember your purpose, the significance of learning, uplifting, and working with those around you, the value of continuing to teach and educate yourself, and to not be afraid of life's curveballs.
That sounds good, Martin. Let's get the show started.
Welcome, Karen. Thanks for joining us today.
Thanks for having me here.
So, Karen, we always kick off our show with this question. All of our care heroes, including yourself, are superheroes. If you had to choose one superpower, what would that be and why?
Just one superpower? You know, as a nurse leader, I feel like I have more than one superpower, but if I had to pick one, I think I would want to fly. So I could get to all the different sites where my nurses work in one day. It takes me a month to make rounds on my team. And so flying would be my superpower.
So Karen, you've had extensive experience as a senior healthcare nursing executive. Can you tell us a little bit about your life story, your background, and how you actually got into healthcare?
People ask me this question a lot. And to be honest, I was born into a pair of Army boots. Both my parents were Army nurses. So I come from a line of nurses. I wanted to be a nurse since I was in second grade when we had to, write the story of what we wanted to be when we grew up. I followed my mom's footsteps. I graduated from high school, went right to a fantastic BSN program for nursing, and then I was a direct commission into the Army Nurse Corps. I served during Desert Storm. I'm very proud to have served our country. I served 11 years. When I separated from the Army, I had very small little people and went back home to kind of get back up on my feet and went back to the medical center that my mom retired from, and I kind of grew up as a new nurse. I thought I would go back there for just a little bit to get back up on my feet. 20 years later, realized that I was still there. Grew up in the service lines, and I then transitioned into a chief nurse role, a fantastic freestanding psychiatric facility, and really enjoyed my career there. And then life happens, as it always does. So I happened to meet the love of my life at 24 years with my last facility, my last healthcare organization, and chose to grow up and leave home. Took this position at Dartmouth-Hitchcock. Oh gosh, it'll be almost 8 years. I've been the chief nurse of Dartmouth-Hitchcock for 5 years and have just had an amazing experience.
Wonderful. Well, I must say thank you for your service, for you and to your parents. Thank you so much. That's just a great way to get into it right from when you're young.
We have come a long way in nursing. I think this is our 19th or 20th year of being the most respected profession in the country. And I'm talking 30, 40 years ago when I started this journey. So I did do pre-med for one semester and then figured out my mistake and transferred into nursing and have never looked back. I do have a wonderful husband and we have 4 children. I'm just celebrating the birth of my second grandchild last week, and I'm just thrilled to have a very wonderful family to support me as well.
Congratulations.
Thank you.
So currently as the Chief Nursing Officer at Dartmouth-Hitchcock Medical Center in Lebanon, could you tell us a little bit about your role and what you do?
My job description says I'm ultimately responsible for the quality and safety care of the patients that we serve as the only academic level 1 trauma center in the state, in the area. My day-to-day job is really to make sure that all employees, staff who care for the patients have the tools that they need to take care of the patient.
Amazing. What do you love most about your role?
the people, patients, nurses, respiratory therapists, all clinicians. I love the door greeters that are keeping our patients safe. They have the hardest job, I think, right now, trying to keep people healthy and safe. I feel sorry for people who have been remote. I think like yourself for a year. I'm a people person. I love that we give such excellent care to patients. I've been a patient myself at Dartmouth-Hitchcock and can speak from firsthand the kind of care that we give. And that's what makes me very proud.
I love the positivity in your voice and the way that you describe things at work, because I've been recently reading about positive psychology and how that affects how you treat work and how you manage your work, and thinking about how thankful you are for the people around you or the things that you're happy about can really change your perspective on your role and your job. So it sounds like you really subscribe to that idea.
Yeah. And Karen, your enthusiasm, and you can really see that your heart and soul is not only into your job, but into the people you work with, which is really important to clinicians around you. What advice do you have of our poor new grads, the new grads that went through and then the pandemic hit? What advice do you have for them?
Well, we actually have a nurse residency program. So I actually get to greet them. I go and I greet every single new nurse that enters the medical center on go day. So every other Monday I go and I get 40 minutes with them, and I kind of give them the care and welcome. And then I go around the room and I ask the nurses, where they're from and what school they graduated from, and then why. What is their why? I really think it's important as nurses, we understand why we do this work and why we went into healthcare, because there are days that we have to go back to that why. So they look at things with very fresh eyes. My counsel to them is to stay the course, hang in there. You are not alone, and we are here to make your successful transition into active nursing to be successful.
That's wonderful. Thank you.
Related question. For some of our nurse manager listeners, I'm curious to know what you do at your facility to retain those nurses. Do you have any special programs of note or anything you do that they might learn from you?
Oh, the nurse leaders. They're the most important people in my team. They have the hardest job. We actually have a pretty robust succession planning for nursing, and we restructured a few years ago. So they are surrounded by support. We have a Leading at DH program. We have quarterly retreats to do team building, but the team that itself, the inpatient nurse leader team, they really rely on each other. It's a very strong supportive team. They have a director that supports them, and really we take from them what they need. We've been able to work with them so they can have some time remote. Boy, the first few months of this pandemic, they were working 6-7 days a week, and a lot of school, all the poor leaders that have kids at home, are they remote? Are they not remote? And that flexibility. So this has certainly allowed us to be flexible.
Absolutely.
How do you continue to learn in your day-to-day to stay on top of things?
I preach this. Being in healthcare is a lifelong learning event. I've been a nurse for 34 years this year, and I've been a nurse leader for many, many years. I'm a fellow of the American College of Healthcare Executives, and I'm actually a governor-elect for ACHE. I'm very excited about that. But it's about continually teach myself and educate myself in what are the new and innovative ways to be a leader. This past year, if you're not a leader who can lead during challenging times and you don't have those skills, then boy, what a year that you've had.
Absolutely. So can you kind of walk us through a day recently that has been a very exciting, successful, and rewarding day to you?
I can. Tuesday, just this past Tuesday was an amazing day. We haven't had one of these days in a long time. So at 0700, we started the day with my president and CEO, Joanne Conroy. We gave a Daisy Award to a fantastic nurse supervisor in the emergency department. We participate in the Daisy Foundation and give a Daisy Award now every other month because we have so many nominations from families and patients. And then about midday, we were able to celebrate. We have been accredited as one of the 12 emergency departments in the country as a geriatric ED. So So we got our accreditation at around 11:30.
Congratulations.
I know, it's super exciting. We're the first rural ED to get accredited. Tons of amazing work this past year to work on that. Maine, New Hampshire, and Vermont are three of the oldest states in the country. And so this geriatric ED program is phenomenal to get the great care to our elderly. And then at noon, I got to celebrate 2 years of CLABSI-free in the SICU, our surgical ICU. So I got to go down and celebrate with the team the amazing work that they've done to keep our patients safe. And then that afternoon, we got to celebrate the nurse leader in Ahmed, who is one of the 6 nurses who have received New Hampshire Nursing Association awards. We received at Dartmouth 6 of the 20 awards. So we got to celebrate Lisa Brown with her team that she received the awards.
That's awesome. And congratulations on all your celebrations that day.
So Karen, how did you get to where you are today, especially factors other than education?
I think the military set me up for very strong leadership skills. I was a lieutenant when I joined the Army, and I was honorably discharged as a captain. And as a lieutenant, as a brand new nurse, you were in charge. You worked with fantastic enlisted people, but you had to learn those leadership skills at a very young age. And then I just had great coaching and mentorship and opportunity throughout the years. I think it's just about the recipe of having good mentorship, good opportunity, some basic characteristics of a good leader, and trial and error. So for sure, I have not always been right or done the right things, but I have learned immensely from them. And I've learned from amazing people.
And how did you find those coaches and those mentors to help shepherd you into these roles and into advancing your career?
Well, my first mentor, who continues to be a very strong part of my life, was a physician, actually, who promoted me into my first civilian nurse leader position. And he picked me over another senior nurse leader. And he just really has been an influence in my life, guiding me and coaching me. As a young leader, I made these mental lists in my head of really good leaders and the characteristics I wanted to take from them, and really leaders I don't want to be like. And I kept those mental lists in my head and really strived to be a really good leader.
Absolutely. I totally agree with succession planning. And I think getting the right mentor to give and receive is definitely a formula for success. So as a leader, what advice do you have for our listeners on the best way for them to work and communicate with management?
For me, it's about building a foundation of trust. You have to be visible. You have to be approachable. You have to round with your team in their space. You have to be transparent in your communication. You have to follow through on the things that you've promised to do. You have to own your mistakes. And then once that happens, people will seek you out to communicate with you. They will come and give you feedback. I solicit it. I actually have a millennial mentor. I started that program for me 4 years ago or so. I need to stay hip and cool. So 60% of my inpatient staff are millennials, and now the Generation Zs are coming in. And so you have to make it safe for people to give good feedback. And I always ask people to come with solutions. Don't come and gripe to me that something. Come and tell me what you think you need to do your job. What can we do differently to make work-life balance different? And how can we have the staff disconnect from work? I mean, these are the new buzzwords of wellness and being able to disconnect at home and have that resiliency. So again, it's about the foundation of trust. If employees don't have trust in their leadership, then it will be underground and they will be quiet. And that is not a good thing.
I love that you have a millennial nurse mentor. Could you tell us a little bit more about that? Like, what's the relationship like? How did you find this person? What have you learned?
So I'm actually on my second run. My new millennial mentor is actually a male nurse, which was really good because, as we know, nursing is, I don't know what the ratio is now, 80% female. So I have a male nurse who's also former military. I always go and just have a cup of coffee. I don't want people coming to my office and, doing all that stuff. So I want to know what from them. How can I communicate with them? They don't want to come and sit and listen to me for an hour at a CNO forum. I wouldn't want to come listen to me for an hour at a CNO forum. So he encouraged me to do some YouTube videos, short, focused. So the very first one I did was with him, and it was really fun. Why did you join DH? How is the nurse residency program? What words of wisdom do you have? So we did just these 3 to 5 minute videos because their attention spans aren't that long. My attention span's not that long. So that was phenomenal. So communication at Dartmouth, I have 4 generations of nurses. So, I have to use many different venues to communicate, to do that. It's very interesting. What do they want to see for education and training? What do they want to see for advancement? They want to check off their boxes. They want to get their next badge. They want to cheat. They just want to continue. So, how do we build our programs around that? Gone are the days of the once a year performance evaluation, daily, weekly, monthly feedback loop. So how do we do that? And how do we do it well? How do we give good constructive criticism? This is a group that's not really been criticized or given constructive criticism. So how do we do that without making them feel like failures? So these are all the things that I want to learn from them. And he's kind of my ear out there.
Karen, one of my biggest challenges was also dealing with the multiple generations. And it sounds like you really have blended the different generation, which is really awesome. Can you name a time that you think was either the most inspiring time or compelling time of your life, something or your career that really stands out as something you've taken along with you?
One of the most rewarding experiences I had is when I was the chief nurse at Acadia Hospital, which is the psychiatric hospital. I'm not a psych nurse. That was my biggest criticism, but my biggest positive was I wasn't a psych nurse. And I want to learn from those around me. And I want to be a better nurse, but I want to better understand how I can improve the care that we're giving to the patient. And to do that, you need to learn from those around you. So I take that experience because I had to learn a lot when I took that role, and they needed really strong leadership, which I could bring to the table, but they needed to teach me how to be a really good psychiatric nurse. And they're just a premier hospital for psychiatric medicine. And I was so proud of my tenure there. But again, I use that experience because I am an ER, like I said, I was trained to be an ER trauma flight nurse. So when I go into the intensive care nursery, and they're micro preemies now, I can't even pick them up, let alone do something with it. But you want to learn around from the team, teach me, and how can I help you care for these patients? So I think it's not one thing, but as I've grown through my career and even my life, you just have to learn from those around you, and everybody has something to offer.
Absolutely. That's awesome.
And similarly, maybe what's the best piece of advice you've ever been given?
Don't be afraid of the curveball. Life happens. I talk to my millennials a lot because they all have this life plan, right? My daughter did this by age 27, by age 28, by age 30. I always say, step outside of your comfort zone. Don't be afraid of what life offers up to you. Experience it. Don't look at it as a negative, because look how much we've had to change this past year. People have had to, delay their weddings. Several nurses that have had to delay weddings and delay having children or delay, whatever. But they've come to say, oh, well, it was meant to be because this happened. Always a firm believer that things happen for a reason at the time that they're supposed to happen, but don't be afraid of the curveball.
Absolutely. I agree with that. Also, congratulations on the number of awards and the recognition you received in healthcare. Can I ask you about the Above and Beyond Award?
I was ER director at the time, I believe. Our psychiatric patients are in crisis. They've been in crisis for so long, and our society really isn't supporting them. And this pandemic has certainly made this 5 times worse. So this was, 20 years ago. And I had a patient who was very, very sick in the ED, and they were going to get ready to transfer her over to the psychiatric hospital. And it was just not a very pleasant thing to happen. And this patient was very scared. And all I did was get in the back of the police car, because that's how we transport them, right? It's not very nice, but that's what we do. All I did was choose to get in the back of the police car and ride over with her, because that's how I felt I should do. I just felt like this patient needed comfort, and this patient needed someone to hold their hand and get there safely. And I had a relationship. Obviously, I actually became the chief nurse of that psych hospital a few years later, and someone saw me do it.
Oh, that's awesome.
A leader saw me get in the car with this patient, and ER nurses have a great relationship with their police and fire friends. And I knew the policeman really well. And of course, he's like, yep, get in the back, that's fine, and all that sort of stuff. And so that was that award, is people felt I went above and beyond. And I just felt like that's what the patient needed to be safe and to get to the next level of care. So I didn't think I did anything stupendous,
We mentioned earlier in the recording that you'd achieved many different types of awards. And just more broadly, for those who are looking to potentially make a real impact in the nursing profession, what does it take to achieve these awards? And what do they mean personally for you?
When I greet the new nurses every other Monday, I tell them that it's not the fancy medicine. It's not the fancy hospital. Patients expect that when they come to your facility. What patients come for is the great nursing care you're going to give them. They come to your hospital and they give you their life. They literally and I tell this to them, I'm like, they come to you, they say, here's my life. Please don't kill me. Keep me warm, safe, and dry, and be nice to me. Patients don't write to me about the fancy medicine they got or the fancy equipment or whatever. It's those small things that you do that the patients write to me about. It's the warm blanket that you bring to the ER patient who's freezing to death because we take off all their clothes. It's great. It's the cup of coffee you bring to the father who's been up all night with a crying child. It's holding the hand of a woman who's been married to her husband for 50 years and she's dying in your ER. I don't feel like the awards are mine. I feel like they're for my team, and the team that I lead is amazing wherever I am. I just feel that that's what they do. But it's about going back to why we do this job, right? I talked earlier about the why. Why do we become nurses? We become nurses to be caring and loving and to nurse people.
Well, that's great because, it really shows that getting medicine or getting that shot, it's table stakes. It's people remember people.
People remember people.
Absolutely. So, Karen, how are you personally staying mentally and physically healthy during the global pandemic, during caring for all the people that you care for every day?
Well, there's 3 things we talk about at Dartmouth that describe nursing, and it's pride, compassion, and resiliency. And those are the 3 words we use to describe. And resiliency is an important one because it's an individual one. And I talk to the new nurses coming in every 2 weeks. You have to find that resiliency. So for me, I thrive on my family. I have a new grandchild. I mentioned that a week ago. So I only get to see them on the weekends. Thank goodness for FaceTime and all that. I love to cook. I actually live apart from my husband during the week. We have separate jobs. We're both in healthcare and we have different jobs. So during the week, our jobs are pretty demanding, but I love to cook. So me and a sharp knife and a cutting board at the end of the day. I exercise. I make sure I am modeling good self-care behavior. I live in New England, so it's not very pleasant out during the winter. So I actually am one of those people that bought one of the home workout things that has a personal trainer in it, which I absolutely love. And I get motivated every day to do that. Can't wait to walk outside again and just cultivate those relationships that you need. People need people. And this pandemic has been very challenging. People are isolated, they're lonely. So we've been doing some Zoom evening events just with the team, come together with a cup of coffee or cup of whatever and come together and share, the day or some laughs or that sort of thing.
Say you got to travel to the future. What does the future of nursing look like to you?
My stepdaughter is in the accelerated nursing program at Quinnipiac. And as I see her studying and learning, and she graduates in August, I think she's already seeing the future of nursing. Telemedicine is here to stay. And how do we connect with patients, especially in our rural region, to keep them healthy? Because we saw this past year, our patients not seek medical care and not have a connection. And they are now so sick that our hospital is really full of really sick people. So I see telemedicine being a really big part of our lives. Millennials want to pick up their phone and do a telehealth, hey, my sore throat hurts and fix me today. So we're already seeing that. We're actually offering that. I see us doing different models of care. We are not going to have enough registered nurses over the next 4 or 5, they say till 2030. So how do we wrap the services around the patient in a different way? And we're doing a lot of that right now at Dartmouth. We're trialing different models of care. We're writing about it. We're doing some outcome data. We're introducing LPNs back to the, Holly, you must remember this. We're introducing LPNs back into the acute care units and building the team model again. We're going to have to deliver care differently. We have the robot that runs around the halls with the pharmacy delivery, which is super cool. We have the technology at the bedside for patients, and we're building this new tower. So we're trying to think of smart rooms so the patient can direct their care a little bit more and have access to their care a little bit more. Hands-on nursing care is never going to go away.
So my final question, we're going to go back to the healthcare, the superhero. If you could change anything in healthcare right now, what would it be?
If I could change anything, I just wish people would make good choices. This past year has been such a challenge to the people in the acute care setting. They're tired. And I wish we could just take the politics out of healthcare. That's what I struggle with the most right now. It's hard for me to see people argue with science and get on each one side of the aisle or the other just for that. Healthcare I just wish it would come out of healthcare. And we just need to listen to the experts. And that's what I wish I could change right now, because we wouldn't be here today if it wasn't for some decisions we made earlier. And I think that we're going to suffer for this for a while. And it's going to take all of us coming together to move into the future.
Absolutely. Great advice.
And Karen, do you have any final thoughts or advice for our care heroes?
You are my heroes, each and every one of you. I thank you each and every day for coming to work. And I hope you love your job as much as I do. And remember that the patients look to us for their care and to keep them safe. And just thank you all. You're all my heroes each and every day.
Man, that was such an awesome episode, Karen Clements. I wish I could have interviewed her. You could tell that her passion for healthcare runs deep.
I definitely agree, Gerard, and I just love the positive energy she exudes. Now, you know what's up next. It's time for the handover.
Okay, Care Heroes, here are our top takeaways from this episode. Find the career path that speaks to you. This way, you'll love going to work each and every day. Always remember why you're doing what you're doing and live each day with a purpose. People make all the difference. Always be willing to learn from those around you and find ways to uplift each other and work together. Being in healthcare is a lifelong learning event. Always continue to teach and educate yourself. And also, don't be afraid when life throws you curveballs. Life happens, move forward, be positive, and believe that things will happen when they're supposed to.
Nice handover. We also want to thank our Care Heroes for listening, and don't forget to rate our podcast on your favorite podcast app. If you want a shout out on a future episode, just visit careheropodcast.com. Go to the Contact Us page and submit your name, role, and location for a shout out on a future episode.
That's right, Martin. Now it's time for some shout outs. We want to give a shout out to Peter, nurse practitioner from Baltimore, Maryland, Kimberly, RN from Salt Lake City, Utah, and Wilma, nurse program manager from Miami, Florida.
All right, Care Heroes, that's it for now. Thanks for joining us on the show. And don't worry, we'll be back again soon. Same Care Hero time, same Care Hero channel.
Thanks for listening to Care Hero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a Care Hero to be interviewed on a future episode.